go. So Jazmine was born in the Duwamish Territory, Seattle, Washington, and was raised in Coast Salish Territory of Maple Valley, Washington. Jazmine completed her undergrad in sociology at Western Washington University in 2018 and completed her certificate in alcohol and drug counseling while working as a substance abuse disorder professional trainee in 2019. She is a lifelong learner who is committed to justice and quality care for all marginalized peoples, but especially our relatives experiencing homelessness, those living with a substance abuse disorder, people who are or have been incarcerated, and individuals diagnosed with HIV or AIDS. In her spare time, Jazmine enjoys writing, baking, watching horror films, and going on walks to look at flowers. One of the quotes she wanted to share with us is, "When I becomes we, even illness becomes wellness," by Malcolm X. And then one other little thing to add is, because it is stormy and windy, you know, if we lose a little bit of light, we'll try to get back to the session as soon as possible. So, you know, try to re-enter through your link. But yeah, I'll pass it on to Jazmine.
Thank you so much for that introduction, Arturo. I really appreciate it. Really love working for Neighborhood House here. Just a few housekeeping things. Like Arturo said, this session is going to be video recorded. Your cameras and mics will be turned off during the presentation until our Q&A time at the end of the presentation. Everyone is welcome to send us confidential questions through the chat. Just please make sure that the drop-down lists Arturo, so he's our co-host today. Please do not share any personal, confidential, or medical information, and we will be sending the presentation in an email to everyone. I'd like to start off by reading our Neighborhood House land acknowledgement. This was put together by our Indigenous, Native American, Alaskan Native, Hawaiian Pacific Islander affinity group. Neighborhood House recognizes that we are on Indigenous lands, specifically the lands of Coast Salish people. We offer acknowledgement to our Coast Salish relatives and cultures, including the Duwamish, the Suquamish, the Snoqualmie, the Muckleshoot, and many other Lushootseed-speaking communities and people. We recognize that we serve communities on lands governed by the 1855 Treaty of Point Elliott, a treaty that has not been fully honored. Neighborhood House also recognizes that we serve Indigenous people who are in King County due to forced relocation from their traditional homelands, and that many of our resources come from the sources that have created inequities for Indigenous people. And if you're ever curious about the land that you reside on or other territories on Turtle Island, also known as North America, you can visit the link below, native-land.ca. Today's learning objectives, we will be going over what a substance use disorder is. In the field, we often say SUD, so you'll hear me use that acronym a bit for substance use disorder. The history of alcohol and drug use and laws in the United States. Risk factors that predict the likelihood of developing a substance use disorder, and drug treatment options in the US versus other countries, and the very unique role that the criminal justice system plays in fueling the drug crisis. Our goal is that by reviewing history, research, and theory, we as a community can better advocate for the health and well-being of the individuals living with substance use disorders. This is a very long definition of addiction, but it's important. It's by the American Society of Medicine. We call it ASAM. Emphasis is mine. Addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and/or relief by substance use and other behaviors. Addiction is characterized by inability to consistently abstain, impairment in behavioral control, craving, diminished recognition of significant problems with one's behaviors and interpersonal relationships, and a dysfunctional emotional response. Like other chronic diseases, addiction often involves cycles of relapse and remission. Without treatment or engagement in recovery activities, addiction is progressive and can result in disability or premature death. So what causes addiction? Lots of things. Some internal factors include like mental illness, behavior issues. So say you're someone who's impulsive, maybe you have low self-esteem. Those are things that can bring people towards wanting to try drugs. External factors include your environment, your peer group. Are you seeing other individuals who use substances? Is that something that's normalized in your family? Those are all likelihoods of developing a substance use disorder. Research shows us that genetic markers account for 40 to 60% of a person's risk of addiction. And then with all of those internal and external factors going on to that, that all increases the likelihood. And that info is from the National Institute of Drug Abuse. Our one right below there is from the National Center on Addiction and Substance Abuse. And then that's about more than 90% of people with an addiction first tried a substance before the age of 18. So we know that individuals, our brains don't fully develop until we're about 25. So everything that happens before that is very, very influential in us. And if you start under the age of 18, developing a higher risk for that. If you look to the right, our graph here by ASAM, American Society of Addiction Medicine, when we diagnosed individuals with substance use disorders, it's a very holistic view. So we don't just look at, are you drinking a lot? That could be part of it, but what else is happening? Are you going through withdrawal symptoms? If you're going through withdrawal, it's likely that you might have a substance use disorder because you've built up your tolerance so high that your body depends on this. Are you using this in hazardous ways? Are you drinking and driving, getting blacked out and driving? That could be an indication that you have a substance use disorder. Social problems. Is this causing fights in your family because of your drinking? Are you not able to get to work because of your drinking? I'm using alcohol as our example here just because of how common it is and because it's legal in all 50 states. Are you having difficulty quitting? That could be a sign of a substance use disorder. And if you look at dimension 2 here, our biomedical complications, that was one that I always really looked at as a counselor, because are you suffering from like liver disease, liver cancer? Is something in your body, is it detrimental to use alcohol along with your body? If you can't keep yourself healthy and safe because your cravings are so bad, this is an indication. Some of the major risk factors. So a lot of research has cited that poverty is one of the biggest predictors for both mass incarceration and substance abuse, but poverty and race are often intertwined, right? If you're a poor Black person, you can't separate your race from your poverty. It's both ways. So poverty being cited as the biggest biggest predictor of both incarceration and substance abuse means that one of the biggest things that we need to solve in our country is poverty. And we also need to solve our racism. 1 in 6 children in the United States lives in poverty. That's 1 in 4 Native Americans, the people who were originally on this land, and 1 in 5 African Americans. Going on to racism, the school to prison pipeline is also a lot more common, meaning that a lot more common in areas where there are people who are disadvantaged. So the school to prison pipeline is this theory that people from disadvantaged backgrounds don't complete school or don't get the proper education, and then they're going into the prison pipeline. So education, race, poverty are all factors here. With that being said, Black students are 4 times more likely to be suspended from school than white students. So what are those Black students probably doing when they're suspended from school? If they lived in a disadvantaged area, they're likely being around other influences like drugs. More than 70% of individuals who are incarcerated cannot read above a 4th grade level. And compare that to yourself. Like, remember what it was like reading in 4th grade. And that 70% of the people who are in prison can't read well above that level. All of this goes back to our education and whether or not people in disadvantaged areas have those opportunities. Mental illness is also a very big factor. If you look to our graph on the right here, almost 40% of those with substance use disorders also have mental illness. And of the people with mental illness, almost 20% have substance use disorders. But it's a chicken and egg thing, right? We can't really decide like which one came first and which one came after. They often influence one another. Protective factors, ways to bring down these risks, include a healthy home environment, positive peer influence, a healthy community, access to education, and a lot of that comes from money and being advantaged. So the US, how do we compare to the rest of the world when it comes to drug use? Not great. We have the highest drug death rate in the world, and it's not even close. If you look at the world average on our graph here, it's 39.6 per million people, and the US is leading the way even compared to the rest of North America. Americans are the leading consumers of cocaine in the world. We are 5% of the world's population, but 27% of the world's overdoses. Americans consume 99% of the world's hydrocodone, 50% of the world's morphine, and 2/3 of the world's illicit drugs. Now, varying sources say that we consume 30 to 80% of the global opioid supply. Most of the research I read and most of the graphs that I looked at said it's 80%. I did find at least one source that said 30, so I am keeping it at 30 to 80%. But regardless, for only being 5% of the world's population, that's a lot. I want to talk really quickly about COVID-19 and substance use disorders, just because it's so relevant to now. There was increased use in substances over COVID, during COVID. COVID's still going on. Increased stress and isolation were factors. This is because folks were having to stay home. Stress was related to economics, not having a job, maybe not having healthcare, being worried for the rest of the world. Individuals who use substances are at an increased risk for contracting COVID. There's a couple of different reasons for this. One is socioeconomic. So the folks who were more likely to contract COVID were folks who couldn't stay home. That's our essential workers. A lot of those live in disadvantaged areas. So our people who work at stores or our restaurant workers. Also, if you use substances, your immune system is lower. If you snort substances, if you smoke substances, your nose, your lungs, those are going to be weakened areas and more susceptible to bacteria. In 2020, in the US, we showed a 30% increase over 2019 for overdose deaths. That's the highest ever recorded in a 12-month period in the US. Almost a 40% increase for fentanyl-involved deaths. Almost 100% increase in synthetic opioids, so like fentanyl, hydro, deaths in the Western US. And then 35% increase for meth-related deaths and almost a 27% increase for cocaine-involved deaths. If you look to our right here, this ad was from Lloyd Manufacturing Co. This is a real ad from back then for cocaine tooth drops, and we used to give them to kids. The US has a long history of prevention or attempts at prevention. One of the first was the Opium Exclusion Act in 1909. It banned the import of opium. A lot of the opium was coming from China, and most of these have been rooted in racism and xenophobia. So it banned import of opium, meaning that it banned Chinese folks bringing in opium and selling opium. But by this point, opium use had actually been on the decline. Opium was still, like, you could still smoke opium, but a lot of the racist and fear mongering was around that Chinese men were going to give white women opium, and then it was just, they were going to do horrible things to them. A lot of this comes out of Yellow Peril, the Chinese Exclusion Act, and by the government grasping and controlling the opium, it means that it was exclusive really only for wealthy white folks. Bringing us to the Harrison Narcotics Act in 1914. This is when coca started becoming more accessible to the rest of the population because Coca-Cola started using it. So it was accessible to everyone else, and that wasn't great for the powers that be. So Black men were starting to use cocaine because it was accessible. And by the time that the Harrison Narcotics Act came around, we banned cocaine and heroin completely to criminalize those who used it. Moving on to Prohibition in the 1920s, I think we all know about that one very, very well. Obviously it didn't work because alcohol is legal today. And Prohibition is very similar actually to how I see the drug war today, in that, people like Al Capone and like the mob were able to control all of that. And a lot of it went underground, pretty similar to how a lot of drugs are today, and that a lot of it is underground, and that there's oftentimes very, very few people who control all of it. There was a lawyer during the Prohibition who did prove that a lot of it was rooted in racism. And he said, I would not say every anti-saloon leaguer, so the folks who are against the saloons and for prohibition, is a Ku Kluxer, referring to the Ku Klux Klan, but every Ku Kluxer is an anti-saloon leaguer. So a lot of the propaganda that they spread was rooted in anti-Semitism, anti-Blackness, anti-immigrant sentiment. Moving on to the Marijuana Tax Act, you'll notice here that I spelt it with an H, not a J that we usually see. That was done on purpose in 1937 by the newspapers and by politicians. They wanted it to look more Mexican. This was like post-Mexican Revolution, and immigrants were coming to the States, and they had to associate marijuana with Mexicans, again, out of racism and xenophobia. Also, some folks said that jazz at the time, jazz music, was evil and produced by people who used marijuana. So that brings us to the war on drugs in 1971. Right after President Nixon announced the war on drugs, he created the DEA, the Drug Enforcement Agency that we know today, in 1973. And it leads us on to the war on drugs. To our left here, you see Nancy Reagan with her trademark, "Just Say No." This quote by John Ehrlichman, he said this in 1994. He was the domestic policy chief to President Nixon. And I pulled it as it was. I think he meant to say "or be Black," but multiple sources that I viewed said "or Black." So that's just how I kept it. We knew we couldn't make it illegal to be either against the war or Black, but by getting the public to associate the hippies with marijuana and Blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. So it was very deliberate. Everything, all of the history that we have regarding legislation with drugs has always been very deliberate and often very rooted in racism, which says a lot about our country and what we can do and what we can convince people to believe if we just paint a marginalized group as the bad person. That led us into the crack epidemic, which is when Nancy Reagan came along. That was almost exclusive to Black communities, and the harsh penalties were extremely racist. Since 1971, so since President Nixon announced the war on drugs, the United States has spent $1 trillion. That's likely a very conservative estimate. Some of the racial disparities. So go ahead and take a look at this graph right to your right here. This is about prison sentencing. Crack and cocaine are the same thing. They are the same drug, but we associate them very differently. We associate crack with the quote unquote ghetto. We associate it with Black folks. Cocaine is not only associated with wealthy white folks, it's kind of celebrated. It's celebrated in our music and our media. Maybe you'll see people with like a cocaine addiction, but it is very glamorous. It's something that you get when you're rich. But because they're the same drug, just in different forms and broken down differently, we were able to convince the public that one of them was bad and dirty and one of them was like still not great. You know, cocaine isn't legal, but they weren't getting arrested at the same rate that Black folks were. If you look at the sentencing disparity, it'll say 18-1 in sentencing disparity against Black folks. That was after the Fair Sentencing Act was passed in 2010. Before that, the disparity was 100-1. So Black folks were getting sent to prison at much higher rates than white folks for essentially using the same drug. And cocaine is a more pure form of that drug. So really, if we wanted to do it by like purity, it would be cocaine would have the higher levels of sentencing. The 3 strikes law also was part of in response to drugs and racism and just crime in general, but crime has been on the decline since the 90s. The 3 strikes law meant that if you committed a felony and it didn't have to be a violent one, that you were locked up for life. So there are lots of Black folks sitting in prison because of this law. This quote was reported in the New York Times and on the Prison Policy Initiative website. Black men raised in the top 1% by millionaires were as likely to be incarcerated as white men raised in households earning about $36,000. So that brings us back to that poverty and racism that I was talking about earlier. Our current crisis, as I'm sure most of you know, is fentanyl versus heroin. This photo here I took from PBS. It is the lethal amounts of fentanyl and heroin. You can see that fentanyl, it's like really just, I mean, it's terrifying to look at, actually. Lots of individuals, and this is very common in Seattle, are getting their pills pressed. So they think that they're getting Percocet, they think that they're getting hydrocodone, and it's being cut with fentanyl and they're overdosing. Fentanyl is up to 100 times more potent than morphine and 50 times stronger than heroin. Of the people who use heroin, 80% of those individuals first misuse their opioids. The government response has been very different to the opioid crisis versus the crack epidemic, and it is racism completely. 21 to 29% of those who are prescribed opioids misuse them. And the death rates for white people between the ages of 25 to 34 have increased. It has decreased for Latinos and Blacks. So white people die more often from opioids. According to the CDC, this is going to be the first generation since the Vietnam War. So like since the mid 60s, that the death rates are higher in early adulthood than the generation that preceded before it, if that makes sense. So this, like since the 1960s, the generation that's here now, like this is the same amount of people dying, essentially, like youth dying and early adulthood dying since war. This graph here from the Sentencing Project shows you the number of people in prisons and jails for drug offenses in 1980 versus 2019. You can see it's just skyrocketed. Every 25 seconds in the US, someone is arrested for drug possession. Arrests for drug possession have tripled since 1980, but there are 6 times more arrests for drug possession than for drug sales. So who is really being targeted? Are we trying to get drugs off the streets, the people who sell them, or are we trying to get just criminalized people who have the disease of addiction? 1 in 5 individuals who are incarcerated in the US are there on a drug charge. People who commit violent crimes and sexual offenses have some of the lowest arrest rates. So it makes you wonder, like, does mass incarceration actually make us safer if violent individuals or individuals who commit sexual offenses are still on the streets and we're arresting people for having a disease? Congress approved over $7 billion in 2018 for the opioid crisis. 5.5 billion of that goes to research, treatment, and prevention in response to the opioid crisis. The US did not have that energy for the crack epidemic at all. The cost of the drug war. If you look to the right here, you'll see the amount that each state spends on prisons per inmate versus education. The Washington state is not great. We're 7th from the top there. And look how small our little blue guy is versus our green line. The criminal justice system would save $4.8 billion if just 10% of eligible offenders went to treatment instead of prison. And it's estimated that 65% of those who are in the criminal justice system qualify. So we would save a lot of money. For every dollar spent on treatment, more than $18 is saved in costs related to crime. Prisons don't even yield close to the same amount of benefit. We spend more than $3.3 billion annually by the federal government to incarcerate individuals charged with drug offenses. Georgia in 2015 spent more than 1.6 times its state budget for SUD services than on locking up people, rather than putting that money towards all of that money towards like SUD services. State governments as a whole spent $7 billion. Federal marijuana legalization would save $7.7 billion per year. It would also yield $6 billion in tax revenue. And that $13.7 billion that would come from that is enough to send over 500,000 students to public universities every year. Some policy from around the world that we can see has been successful. So Portugal in 2001 criminalized all drugs. When I was doing research for this, you saw photos and heard testimony of needles everywhere, all over. They had high rates of HIV transmission due to IV drug use. Once they decriminalized drugs and started working on community, and rather than punishing people, their rates have gone down. You can see that their overdose deaths have plummeted, their new HIV diagnosis to injecting drugs has plummeted, and the number of people incarcerated for drug offenses has gone down. The Netherlands has legalized marijuana, psilocybin, also known as magic mushrooms, and to decriminalize most substances. They report smaller numbers of cocaine and marijuana use than we do, despite having legal marijuana. Switzerland has approached a 4-pillar model treatment. Similar to Portugal, they were having just fields of people using substances, shooting up, using needles. Once they introduced this 4-pillar model that is pretty holistic, it's prevention, treatment, harm reduction, and law enforcement. They started to see success. They also have drug consumption rooms where individuals can go, and if you overdose, there are folks there to help you. And those drug consumption rooms also include resources and referrals to other areas. So our current responses by the US, we do have treatment here. We also incarcerate folks. Some of the relatively new stuff that we've been doing is harm reduction, so medication-assisted treatment, also known as MAT. Those drugs help curb cravings or block your opioid receptors so you can't get high. Not everyone is qualified to use those. I know when I worked as when I was working as a counselor, we had a doctor on staff, we had a therapist on staff, we had advanced registered nurse practitioners on staff, and the doctor is the one who decides that. I know that not everyone qualifies, so it's one of the few ways. We also have clean needle exchanges. That's something that we have here in Seattle. Ever since those opened up in the US, HIV diagnoses in individuals who use needles to use their drugs has dropped by almost half in a decade. So it is a public health issue. And 97% of the needle exchange programs in the US offer referral and info to other services. So it's not just walking in and getting your clean needle. It's, hey, do you need a referral for this? Hey, can I help you out with this? They are areas where if you are searching for help, you can get help there. Some of the barriers to treatment, if you look at this graph over here, or graphic over here by the Recovery Research Institute, it talks about the stigma behind substance use disorders. You'll notice that I say individual with a substance use disorder, individual who is incarcerated, individual who, it's person first language. It's very wordy, but it's about giving people, like, recognizing their humanity. When you refer to someone as a substance abuser, or you say like, that person isn't clean because they're still using drugs, or you say like your UA was dirty. It seems very small, but those things stick with us. This study showed that when you refer to someone as having a substance use disorder, people see you as more likely to benefit from treatment, more likely to not be as threatening, just by simple word changes. Other barriers to treatment is our current healthcare system. It's just like, I'll just say it, it's not great. And it's horrible compared to the rest of, industrialized nations. It's just not great. So our current healthcare system isn't really very helpful for folks who have substance use disorders. So I remember when I worked as a counselor, having to be extremely, extremely, extremely thorough in our assessments, because you submit an assessment to insurance and they don't want to pay. They'll just say no. And those people aren't qualified at all to make those decisions. They aren't substance use disorder professionals. They aren't doctors. They can't make those decisions. But with the way that our current system is set up, it makes it difficult for people to be able to afford it. The laws in this country, similar to people who are insurance, the people making laws surrounding drugs and drug use are not substance use disorder professionals. They're not doctors. They don't have the same level of experience, like person-to-person experience, that those of us who have worked in the field do. So they don't know what they're really doing. Access and resources. Part of what we do with Project Handle is we go out into the community. That's the program I'm a case manager for here at Neighborhood House. We go out into the community and we offer free HIV and hepatitis testing. We also offer needs-based assessments. And sometimes when we meet folks out there, they are interested in getting connected to substance use disorder treatment. They just don't even know where to start. So a lot of individuals, it seems easy for those of us who are in the field to say, oh, you can go here or you can go over here. But a lot of people just really don't know what's offered and even how to access it, whether or not they can afford it. And one of the biggest ones is money. I saw this one all the time when I was a counselor, people who had to put their stuff on credit cards. This is from North Point, Washington, this specific number here. And this is before insurance. So a lot of times insurance does cover folks, but this is the average cost in Washington state without insurance. For inpatient, meaning residential treatment, it's 30 grand a month. And outpatient is around 500 per session. Outpatient is often 1 to 3 hours of treatment. So 1 to 3 hours costs someone $500 before insurance in some cases. This graph here is from the Prison Policy Initiative. It's just one slice of the pie of those who are incarcerated. So this is specifically about those who are in federal prisons, not state prisons, and not jails. If you look at the bottom here, you'll see how big of a chunk drugs, or those who have been convicted of drug crimes, that's how many people are in there compared to other folks. You can barely see violent crime, barely see property crime, barely see homicide, robbery. Excuse me, it's mostly individuals who are using substances. Our prison population since the 1970s, in line with the war on drugs, has increased more than 700%. We have the highest incarceration rate in the world. We're 5% of the world's population and like 25% of the world's prisoners. The incarceration rate, to compare it to another country, in Norway is 75 per 100,000 people. They have the world's lowest recidivism rate at 20%. Recidivism refers to whether or not a person's going to return back into prison or jail. The US has an incarceration rate of more than 700 per 100,000 people. We have a recidivism rate of more than 70% within 5 years of release. So we are doing something wrong. All of this just shows that we are not on the same level as other countries when it comes to handling these issues. Currently, 2.2 million individuals are incarcerated in the US. And like I said before, crime has declined since the 90s. If you look to our right here, this shows the increase in deaths from drug and alcohol intoxication. Between 2001 and 2018, overdose deaths in prison increased by over 200%. The deaths from drug or alcohol intoxication increased by more than 600%. Research estimates that up to 65% of those who are incarcerated meet the criteria for a substance use disorder. There is no higher risk time for anyone than the 2 weeks after release when it comes to overdosing. So an individual who is released from prison, found several different numbers on this, is anywhere from 74 to 120 times more likely to overdose than the general population. And that's because the drugs that they are getting in prison, they're usually not taking as much. It's usually cut with a lot of things. And they get back out and think that they can use the same level of drugs, or they think that their tolerance is the same and they overdose. So we're putting people into prison for drugs, and then we're releasing them and not giving them any resources during the highest time that they're likely to overdose, which is ridiculous. During COVID, a lot of visitors and a lot of the states and the prisons and the jails stopped having visitors because of COVID. And they were hoping that the overdose rate would plummet. And they discovered that between anonymous interviews between the prison population and the staff who work there, they're learning that the staff is the one who's bringing in the contraband a lot of the time. They're the ones who are bringing in the drugs. Corrections officers are often very, very overworked, very, very underpaid. It's pretty lucrative to sell drugs to people in prison when you're a corrections officer. In addition with that, a big part of the reason why there's overdoses is because if the staff is if the prison is understaffed and there are 2 people in a cell and someone's overdosing, but there's only 1 person on duty, that person's not going over there without backup. So everything about this system has it set up that people will overdose. Black Americans feel the biggest brunt of this. We make up Black Americans make up 12.5% of drug users, but 30% of drug-related arrests. We're 4 times more likely to be arrested for marijuana than white Americans, despite similar rates of use. We're 6 times more likely to be incarcerated for drugs. On average, a Black defendant on a drug charge will spend close to the same amount of time incarcerated as a white defendant on a drug charge. This also brings me back to when I was talking about poverty and opportunity. There's research that shows that a Black American who applies for a job can sometimes be less likely to get that than a white defendant with a violent criminal record, or a white applicant who is a felon. Prosecutors are twice as likely to pursue mandatory minimum sentencing when compared to a white defendant because racism. So it's not all doom and gloom in the US. There are some states and cities that are taking some action. In Rhode Island, their jails and prisons offer, or they provide harm reduction medications, and those have been very, very successful and proved to be very helpful for individuals, especially individuals who suffer from an opioid use disorder. Vermont is also offering treatment and medication. Massachusetts, if you walk into their police departments in Massachusetts and you surrender drug paraphernalia, they will connect you to help. Here in Seattle, Washington, the law enforcement assisted diversion was going out with the police as an alternative to police response when it comes to drug use. Now they are starting to do that on their own and be their own thing as an alternative to the police being called, and as a mental health resource that we've talked a lot about during George Floyd and during criminal justice reform. And the First Step Sentencing Act was passed in 2018. It revised mandatory minimum sentencing. It also requires that the federal government do something to handle the recidivism rates. So generational cycles, if you look at our graph here, most people in prison are poor, and poorest are women and people of color. It's very difficult to combat this crisis, the drug crisis, when we are just re-traumatizing and re-victimizing people all of the time. So children of incarcerated parents, and you have to think that a lot of if we're talking 1 out of 5 people in prison are there for drugs, a lot of those people are probably parents. Children of incarcerated parents are 6 times more likely to develop an SUD in adulthood, almost twice as likely to have diagnosable anxiety. Anxiety, as we know, is internal. That's one of our risk factors for developing an SUD. An estimated 25% of children grow up in a home with substance abuse, not substance use disorder. I do want to make that clear. So substance abuse can be like binge drinking or chain smoking cigarettes. It's not necessarily substance use disorder. But 25% of children grow up in an area where they are seeing this level of consumption of substances that maybe isn't healthy or maybe shouldn't be in front of kids. Children of those with a substance use disorder are 4 to 8 times more likely to develop an addiction of their own. Of the women who are incarcerated, 60% of them are mothers to children under the age of 18. Traumatizing for kids, and really just keeps them in that cycle of either poverty, like if someone's not bringing in income into the home, trauma, and social mobility. If you're born into poverty, you're very likely to stay there. So if you were here in July with us for one of our speaker series, we had the honor of hosting Ijoma Oluo, and one of the things that she said that has just stuck with me, I think about it probably every day, is she said white supremacy is a lack of imagination. And all of our legislation, a lot of our laws, a lot of the social issues that we have in the US are due to white supremacy, and it's due to that lack of imagination. It's due to this individualistic capitalist culture where we've lost our sense of community. If you go date back way far back, like the earliest humans, like they lived in community. We are hardwired for community. Humans need connection. It's not beneficial to release people back into poverty or into these places where there's not community. And people who live in poverty, it's not a lack of not wanting to, it's not that they don't want community. It's that where do they have time? When do they have time to do that? Or like with what resources are they supposed to do that? Prison is traumatizing. Post-incarceration syndrome is a real thing. Some research shows that of those who are incarcerated, 30 to 60% show rates of PTSD. The average is 3 to 6% in the general population. With all of that money, all of those costs, all of those trillions and billions and millions of dollars, all of those numbers I quoted before, if we could even redirect like some of that, like a small percentage of that to community needs and investing in people and not in punishment, we might see some change. We have to invest in housing. We have to invest in a living wage. We have to invest in healthcare and education and quality food and family support. We have to invest in all of that because we know that those are major risk factors for substance abuse. And if we can't address those, then all we're doing is putting on a Band-Aid to the wound that's already there and isn't going to heal properly. Humans are meant to be in community, and what we really need to do is follow other countries and other places that have shown through research, through data, through very, very long studies that this is possible. It's possible in America, and we need to stop treating a substance use disorder as the fault of the individual, and we need to start treating it as what it really is, and it's a societal failure. And what we have set up right now, this mass incarceration, the way that we treat individuals who suffer from substance use disorders, the way we treat people in poverty, the way we treat people who are marginalized is a societal failure. So I wanted to end on, we're close to the end. This is a quote from Brian Stevenson. He wrote this book called Just Mercy. It was very, very good. I highly recommend it. He worked very closely with individuals who are incarcerated. And it says, "My work with the poor and the incarcerated has persuaded me that the opposite of poverty is not wealth. The opposite of poverty is justice. Finally, I've come to believe that the true measure of our commitment to justice, the character of our society, our commitment to the rule of law, fairness, and equality cannot be measured by how we treat the rich, the powerful, the privileged, and the respected among us. The true measure of our character is how we treat the poor, the disfavored, the accused, the incarcerated, and the condemned." I'm just going to end with our neighborhood house mission statement. I am like so proud to work here, so proud that we've been leaders in the community forever. Neighborhood house has been around since 1906. And our mission statement is neighborhood house builds community, emphasis mine, and increases access to housing, health, education, and economic opportunity. Some of our other values include equity, sustainability, and relationships, but because this is mostly about community, I decided to highlight our community value. And it says, "We welcome all, embrace diversity, and foster belonging. We are embedded in community. We partner with individuals, families, schools, housing authorities, healthcare providers, and communities to fulfill our mission." Okay. Thank you so much for joining. Any questions? I've also left a couple of just my favorite like media and a couple of organizations that I really appreciate if you want further info or if you feel the need to look at those.
Thank you so much. It was really inspirational as to the problem that needs solving. Is this your own slideshow?
Yes, it is. Yeah.
That's awesome. Yeah. I appreciate that. I have been trying to do some work with the local moms group in my area that's doing gun sense accountability. So they might be interested in, something along these lines in the future if you're sharing it with other people.
Yeah,
So,
absolutely. Yeah.
Okay. Thank you.
Yeah.
Question in the chat, Jazmine, if you see that from Cheryl.
I do see it. Cheryl, do you want to elaborate on what your question is, please?
I was just sitting here thinking, I care for homeless people, and methamphetamine is a huge problem in Seattle. I think it doesn't become part of the conversation a lot of times because we really don't have research established treatments. There are some things going on in the research community looking at how to reduce the rates of methamphetamine use and how to treat people who have it, but it's a huge problem, and it's a lot of times people use multiple substances at the same time, and there's a lot of heroin and meth use in collaboration. So, just wondering if you'd seen any data on that, or could discuss that.
Yeah, I do agree with you in that I think that it gets lost often. Like we have the crack epidemic and we have the heroin crisis and we have reefer madness, but no one ever really talks about the meth crisis. And I do wonder if a lot of that has to do with, I have seen a lot of that in men who have sex with men or individuals who are diagnosed with HIV. And I wonder if maybe that's part of keeping that, like maybe why that sort of gets forgotten is because, and maybe you can speak to this for your work, but when I've seen it, it's been a lot of individuals who are homeless and a lot of men who have sex with men. So I think a lot of it is stigma.
It's not just people experiencing homelessness, but yeah, the MSM is also an issue. Right. And there are different ways to use methamphetamines, right? So depending on whether you're injecting or smoking or whatever, but it's a very, very damaging drug. I mean, you could use heroin your whole life if you had clean needles and you knew how much you were injecting and you wouldn't have organ damage. And I was told that around 30% of the people on the wait list for cardiac transplants at UW are under 30 who have a history of meth use. It's an incredibly damaging drug.
Wow. Yeah, I'll have to look further
kills
into that.
people.
That sounds amazing.
Yeah, it's not about overdose necessarily, although that can happen, but it's about essentially destroying their body.
Mm-hmm.
Yeah. So, but we don't talk about it. I think it's a bias towards people who use methamphetamine, that they're somehow not worth helping. I see that a lot.
Yeah. Yeah. Thank you, Cheryl.
I'll share one question from someone sent to me was, what can someone do if they suspect a loved one has a substance use disorder?
Ooh, okay, good question. I would talk to them and express why you believe that. So is it like when we talked about the dimensions earlier, is it because they're putting themselves in reckless situations? Is it because you're finding them passed out on the couch with like vomit coming out of their mouth every night? What are the specific reasons why you believe that? And approach them. It's very, very, denial is the biggest thing when it comes to substance use disorders. So a lot of people might, like the individual you're speaking to might not take to that. And that's the reality of the disease, is that a lot of people just don't accept it at first, for many reasons, stigma especially, right? And this idea that like I can control it, it's not an issue, I can do it. I would do my best to be there for that person and express how I feel. But when it comes to individuals, especially when they're adults, it's a decision that they'll have to come to on their own. So maybe sharing resources or reading and furthering your information or furthering your knowledge and passing on that information to other people. But it's a difficult position to be in, to try and tell someone that you suspect that, especially because they might become defensive. And a lot of that is it's just ourselves, right? We don't want to believe some of those things about ourselves, especially when we live in a society that really criminalizes it and shames people for having it.
Thanks for that, Jazmine. And we still have a little bit of time. Oh, there's one that came in through the chat.
Oh, from Janice. How do you support someone that's going through substance use issues and not enable? Oh, it's so tricky. I would have lots of, parents come in. I worked with people who were 18 and up, but I saw like lots of folks in their early 20s and parents who would come in, or spouses who would come in asking what to do. I would say it's very difficult and it's case by case, and I like hesitate to give out this advice. But I would say talk to the person and set boundaries. set boundaries about what you're going to do with the people, and be honest with yourself and true to yourself about those boundaries. So if you're saying to someone, I'm not going to let you use in my house, like, let's say, I'm not going to let you use like whatever substance in my house. And if that person starts using, or if you like find those, like maybe bottles somewhere, or maybe a pipe somewhere, you have to lay down the law. Boundaries are the biggest thing. It is a pretty high percentage, yeah.
Yeah, I'd have to say some of those images, facts, and things were just, they are eye-opening.
Pretty mind-blowing, yeah.
Any other questions?
Can I ask another question, Jazmine?
Sure.
So what do you, and so marijuana is legal now. So, say hypothetically, you have a 22-year-old child that lives in your home that is legally, smoking or drinking or something like that. It's not like, how do you know like what is appropriate? And, because it's legal, I don't think that it's interfering with school or work or things like that. But like, how do you know when to maybe intervene or take some more, to do anything about it?
I would say if you're already wondering about it, then there's probably a lot more. Okay. If you're already wondering about it, it's very likely that maybe you aren't seeing things. And that doesn't mean that someone has a substance use disorder, right? Or a substance abuse issue. But if it is something that you're curious about, I would open up that conversation, see whether or not a person gets defensive, how defensive they get, if they're even open to changing their habits at all. If someone isn't open to changing their habits, especially when it comes to like their loved ones, and especially when it comes to legal drugs like alcohol and marijuana, because most of the people that I was a counselor for were there for alcohol, like way more than everybody else. So it's definitely an issue because it's very normalized here. And in a place like Washington where marijuana is legal, it can definitely become an issue. So I would just open up the conversation, chat with someone about it. And if you notice some of those dimensions, like if schoolwork is slipping, if work is slipping, if someone is blowing off even just plans to hang out with people because they want to smoke and get high, those are pretty good indicators. Driving while high, blowing way too much money on marijuana, things like that. If it's disrupting your social or your medical or your obligations, or if the people around you are bothered by it, it's time to look inward about it. I hope that helps.
Thank you, everyone, for this conversation. We have about 3 minutes left, so I wanted to give the floor just one last time to Jazmine for any closing statements that you'd want to share with everyone for wrapping it all up.
Sure, yeah. I just want to thank everyone for being here. This was great. Very glad we did this. Join more of our speaker series. I've attended most of them. They're all great, and have rewatched all of them, and they're all great. Moving forward in this not quite post, but COVID world, the emphasis has to be on community. We cannot do anything without community, and we cannot go back to how it was before. So community. See how you can volunteer, see what you can do for a neighbor. It doesn't have to be big. It can start small, but those small things have ripple effects. Cheryl, did you have a question?
No, I was just impressed because community is what matters. You're
Yeah.
right.
We are all about community here at Neighbor Now, so I love it. Thank you so much, Jazmine, for this time with spending it all with us, and great presentation. And yeah, something so vital is just our community well-being. So I love it. I love the emphasis. Sounds like Jazmine will be available to share the slides, contact information, and some resources with us. So I think expect a email. It takes a little bit to load the video and everything, so probably by tomorrow. We appreciate everyone for coming in and taking the time. Glad the internet was good and the rain and wind didn't scare us off. We're going into this time kind of like the holiday season where, you know, the end of the month is kind of a little bit more difficult to have these speaker series at the days we usually have them. But we were expecting to have one more for November, December. So, you know, expect an invite to that one as well. So yeah, thank you everyone. Have a great evening.
Thank you so much all. Goodbye.